My name is Heun. I'm a consultant psychiatrist, professor of psychiatry, and my endeavor is to teach people or let people learn and hear about common mental health disorders. And this might be for experts, psychologists, mental health workers, or patients or relatives. So today we come to panic disorder, and I'd like to go to the symptoms. And first, to say what's a panic attack. A panic attack is a period of intensive anxiety with a series of symptoms. Usually it develops rapidly, it reaches a peak after 10-20 minutes, and then after a while it gets calmer. Very often it doesn't last for the day, maybe an hour, but that's usually a high time or a long time. Usually these panic attacks are spontaneous, so completely out of the blue. Some are situational, like agoraphobia, where people are very anxious to be in different situations. I might come back to that later. Some appear in the middle of the night without any triggers, maybe a dream, but usually these disorders come out of the blue. The only one thing which is very common is that people, on top of that, have anxiety. So after people suffer for a longer time, the anxiety is more about the anxiety than any other trigger. So usually it should be recurrent, come back several times. A one-off panic attack in a lifetime or once a year wouldn't be called a panic disorder. So usually if it's daily, then it would be called a panic disorder. The criteria are different from DSM-3 and DSM-3, 4, 5, and ICD-10. Usually they change a little bit, and what it really reflects the fact that there's lots of variation in human conditions, and it's very difficult to put it into a drawer or put it into a framework. Right, okay, the symptoms can be physical, can be tremor, tachycardia, hypertension, sweating, and hyperventilation. Palpitations are very common, accelerated heart rates, sweating, trembling, shaking of arms, legs. There's a shortness of breath, or the feeling of shortness of breath, not being able to breathe or not being able to swallow. People report chest pain or physical discomfort about the chest. There's often nausea, abdominal distress, dizziness, unsteadiness, lightheadedness, or even feeling of fainting. There's sometimes a feeling of derealization, which means people are in a different area or feel that their area is where they live is different from the real world. Or they feel that, they don't feel that they are the same person, and that's called depersonalization. There's this fear of losing control or going crazy. Fear of dying is very common. Hot flushes, numbness are very common. So all these things are very often seen in a panic disorder. People have anxiety of dying, not just during this episode or the one episode, but in general having these episodes. Usually the difficulty for the GP is to realize it or to know that there are physical health problems which might trigger the attacks, like an oncoming heart attack, chest pain, back pain, headache. These are all symptoms of many diseases, and can be very stressful and can trigger panic attacks or can be the cause of panic attacks. Thoughts of suicide can be very common. People can be very impulsive, but that's usually not the main problem. So usually the main problem is the anxiety of anxiety, which then triggers more anxiety. The lifetime prevalence is quite high. If you look at anxiety in general, you come up with up to 10-20%. If you just look at panic disorder, it's about 2-3% of the population. As I said before, it might very much depend on the criteria you use. And previously it was that panic disorder was always associated with agoraphobia. So agoraphobia and panic disorder in ICD, I think ICD-9 and DSM-3 were one disorder, and now it's again split and with a high amount of comorbidity. Comorbidity meaning that diseases appear together. So a very common comorbidity is anxiety and depression. There are many disorders. I think you can look at alcohol abuse and alcohol withdrawal. Drugs can lead to panic disorders, which are getting more and more common sense, sadly. Blood disorders, cardiac arrhythmias, atypical chest pain, COPD are all diseases which are relevant. And to exclude the panic disorder, it's or the cause of the physical cause of panic disorder, it's important to make some assessments. So maybe blood may be important. An ECG might help to detect arrhythmias, and some blood tests for drugs might be important depending on the history. Diabetes or multiple sclerosis and other diseases might be behind the disease, but that's very, very uncommon. So I hope it helps. I hope I can give more clarity about these issues, and I think in my view it's very important that the society is formed from experts like me, I just say that, about mental health problems which can be treated. Have a nice day and enjoy the heat at the moment. It's very hot here in Glasgow today. If you are interested, please like it and subscribe to our channel. And if you can, promote our channel, because we want to reach people who might profit from our service. If you want to read any papers, Global Psychiatry Archives is the right place to go, or even to publish. Thanks a lot and have a nice day.